Ada's pregnancy was unplanned, but that's not uncommon. Like many people in her situation, she felt scared, didn't have a lot of information, and felt this immense pressure to make a decision fast. What really surprised her was how little space there seemed to be for questions about her body, about the risks involved, about what would happen after she made her choice. She decided to end the pregnancy because, at that moment, it felt like the safest and only viable option for her. Medically speaking, when managed properly, an abortion is often a safe procedure. But what often gets overlooked is that the experience doesn't just stop when the procedure is over. The emotional and physical journey continues, and Ada wasn't prepared for that part. In the days that followed, she started experiencing symptoms she didn't expect. There was this persistent pain, a deep weakness, a fever, and an exhaustion that felt far beyond what normal recovery should feel like. At first, she hesitated to get help, and a lot of people do. There's this unspoken belief that you should just tough it out, that asking for help or questioning your recovery means you regret your decision or that you've somehow failed. But complications are a real possibility. Infections, retained tissue, and other medical issues can happen, especially when follow-up care is skipped or delayed. Ada didn't learn this from a brochure, she learned it from a hospital bed. What stuck with her more than the physical pain was the emotional fallout. She felt completely unprepared. Not just medically, but mentally. No one had really explained how crucial aftercare is. No one told her that recovery means actively monitoring your symptoms, going to your follow-up appointments, and allowing yourself to feel whatever emotions come up, whether it's relief, sadness, numbness, or a mix of everything. Ada's experience taught her a very hard, but incredibly valuable lesson. Reproductive health care isn't just about having access to a procedure. It's about having access to information, to support, and to continuous care throughout the entire process. Healing took time. With the right medical treatment, her body recovered, but the whole ordeal completely changed how she viewed her own health and the decisions she made about it. She learned to be her own advocate, to ask questions without feeling ashamed, and to understand that needing support doesn't make you less autonomous, it actually makes you stronger. Ada's story isn't meant to scare anyone, and it's definitely not here to pass judgment. It is here to educate and to serve as a reminder that making an informed choice requires more than just a sense of urgency. It requires clear, accessible information, professional guidance, and real compassion both before and after the decision is made. Because the ultimate goal of healthcare shouldn't just be to treat a condition, it should be to protect and support the person who is living through it. If you or someone you know is navigating a similar situation, please know that support is available. You can reach out to the All Options Talkline or Exhale Pro Voice for non-judgmental post-abortion counseling and resources. Your well-being matters, and you don't have to go through it alone. Thanks for listening.